Hey guys, Dr. Kilfoil here. We have a follow-up to a previous video. We had a previous video about a patient who got a arterial bypass. The link to it is over here, or we might just recap it a little bit. But pretty much what happens is that the guy failed an angioplasty / angiogram. A lot of times when this happens, patients end up with an amputation. But luckily at my hospital, we have a very talented vascular team, and they performed an arterial bypass, bypassing the blockage that was behind his knee, or in the popliteal arteries, bypassing the superficial femoral artery, and putting a bypass graft onto the anterior tibial artery. And you can see on this original video that you can see the pulsing of this artery, after the graft. That is the graft right there, which is really interesting, fun to see. It's fun to freak out the podiatry students rotating through your program, like, hey, what pulse is that? What you feel right here, tell me what pulse that is. Obviously, it's nothing anatomic or, that naturally happens in a person. So anyway, this guy, we brought him to the operating room right after his arterial bypass, and anticipating that we may have to amputate him. In fact, that's how I consented him. I consented him for a debridement of skin, soft tissue, and bone, and removal of any, necrotic or non-viable tissue, including and up to an amputation of the third toe. And it's a tough conversation to have with somebody, telling them that they might wake up without a toe and that they can only count to 19. But when we opened it up, it was bleeding so beautifully. I was so very happy that I got to report back to the patient's family that no amputation was necessary. So what we did instead was we took a piece of bone, we sent it off to pathology to see what kind of bacteria or organism was infecting the bone, and turns out that this was a fungal osteomyelitis. Now this gets me excited because I'm going to be at least able to write a poster about it, or force the residents to make a poster about this, and then add to my prestige within my hospital. It's just, it's just kind of rare. Not all the time do you get a fungus that infects the bone. It was a Candida for anybody who is watching who knows. But pretty much, I'll get you those pathologic slides, hopefully before this video publishes. So we took him to the operating room, took the bone, debrided the non-viable tissue. It was beautiful, bleeding, great tissue, slapped on an Integra layer. And this video is us removing the bilayer. I'm peeling the top layer off, and underneath it, it is already granulated in. The wound bed is beautiful, and I cannot wait till this guy heals, and he's gonna heal great. And that toe had its days numbered, but not anymore. This guy, I'm not sure if he really appreciates the intervention that occurred in order to save his toe and possibly the rest of his foot. Because once one of them goes, sometimes it's just a cascade and leads to an amputation of the whole foot, also known as a TMA, as transmetatarsal amputation. And the worst case scenario, a below knee amputation would possibly have happened to this guy. So yeah, that's the video. Let's we'll try to get those slides in here. If we do have them, we can pop them up right here on top. Pretty much the fuchsia, the pink is cytoplasm. That's kind of like the cells that are kind of normally there. And the Candida has a very special kind of stain to it, and that's probably the dark purple. I haven't seen the slides yet, but this is just my understanding of it. And that's those little circles are the Candida, and they don't belong in there. And this guy had that inside of his bone, and we're going to and so he was discharged with diflucan daily, with close follow-up with infectious disease. Now I don't know if the Candida was found to be resistant to terbinafine. Probably wasn't, but terbinafine wouldn't need your interval routine liver function tests like diflucan does. Diflucan is known hepatotoxic, so he's probably getting weekly, if not bi-weekly, liver function tests, blood tests, as directed by the infectious disease. But who am I? I'm just some dumb podiatrist, and the infectious disease doctor is managing his infectious disease. So thanks for watching, guys. This has been Dr. Kilfoil with a follow-up to an initial video. Thanks for watching. Like and subscribe for more content. Just remember, every day is the best day of your life.